Hi, I'm Michael Short. Today we're going to be going over a knee examination. Now this can give us a better insight of what's going on inside the knee after an apparent possible injury. This can alleviate the use of an MRI or an X-ray, saving you tons of money. All right, if you can come on up here. I'd like to welcome my daughter Charlie Short. So with an apparent knee, any type of injury, we need to start off with patient history. So you need to ask your patient some specific questions to kind of help narrow down what's going on. So with one finger, can you show me where it hurts? Okay, and what happened?
I fell off my bike.
Okay, so we have blunt force trauma. So this can alleviate some concerns about structural integrity like ligaments, most of the time. All right, after a good patient history, let's move on to the examination. We're going to look at inspection. So we're looking at both of these knees side by side. You want comparisons. We're looking for any abnormalities like deformities or edema. Edema is just inflammation in your knee. All right, after an apparent inspection, everything looks fine. We're going to move on to palpation. Now palpation just means you're going to be touching the knee and feeling. Again, looking for any abnormalities in both knees. All right, so okay if I touch your knee? Okay. So when you're touching the knee, you can come on closer if you want. So you want to feel both knees simultaneously, moving back and forth, just walking her joint line here. Tick a little bit?
Yeah.
Okay. So since she pointed at her patella, we can just kind of focus on there. But a good proper examination, you're going to go over the entire knee. Next on, we move on to range of motion and strength. So range of motion and strength. You're going to ask your patient to slide around, put your butt here, let your knees hang off. We're going back to the camera up. Swing around. All right, so flexion and extension. All right, ask your patient, can you kick up, bring it down? Can you do the other one? Bring it back down. Cool. Now with resistance, to test your strength. All right, kick up. Good. Kick up. Good. So everything's about the same. All right, so come on back. All right, next, since we checked our strength and range of motion, we're going to move on to special tests. Now, since we kind of know it's blunt force trauma, we don't really have to check the entire knee, but it's good practice to do it. All right, so come on in a little bit. So let's start off with the Lockman's test. Our Lockman test checks the ACL. Now, we can also use the anterior drawers, but we're just going to stick with Lockman. So to check the LCL, you're going to relax your knee. Relax your knee. Every time a patient is going to be rigid, so try to relax your knee. So what we're trying to do is we're going to take the femur, the tib and fib, and we're going to try to make anterior translation. So anterior translation, so this is your femur, this is your tib fib. So we're seeing if we can separate these two. That would indicate an apparent ACL injury. All right, for the posterior drawer test, we're going to bend your knee. Next, we're moving on to the PCL. All right, you're going to sit on your patient's foot. I won't do that to you. All right, and then you're going to push it back. You're going to push her lower leg back. And you're looking again for posterior translation. Again, you're trying to push it back. All right, we can also do the sag test, but we're just going to stick with the posterior drawer test. Next, we're going to check the lateral components. All right, our lateral components consist of your LCL or your MCL, your medial collateral ligament, and your lateral collateral ligament. So we're going to check valgus and varus. All right, we're going to try to stress the inside of the knee here. And again, so this is your knee. We're trying to look and see how much flexion we have. Then we're going to do it to the other side. All right. Next, all right, if you can lay on your back, we're going to check the meniscus. Yep, you're going to lay on your back. So the meniscus are those little cushions inside your knee, okay? Come on. We'll be real quick. So as you're doing this, you're going to cup the knee, hanging on here. You're going to rotate the heel back and forth, and you're just going to move it around looking for any popping, clicking, or pain with your patient. All right. So as you're doing these, you're going to be doing it to both legs. I want you to keep that in mind because you're going to compare each leg. If you have more translation with one leg between the other, that could be a possible injury. Also, there are multiple tests with each ligament. Whereas I just done the McMurray's for the meniscus, there's also the Thessalys. That's the one I prefer the most, but we're just going to stick with the basics right now. All right, any questions? Knee looks fine. Good job. All right, that's it for today, folks.